first of all, great having you, of course. And second, could this be the administration's way of sidelining inconvenient health data with fewer staff?
Thanks for having me, Diego, first of all. Well, this is very disheartening because when we consider what the CDC does, the CDC's purpose is to safeguard the health of all Americans. And a lot of the people that have been laid off are people who are responsible for preventing outbreaks. They're responsible for combating infectious diseases. They're responsible for things like violence prevention. They staff, mental health and substance abuse programs. So when you get rid of a lot of these people and these players, you're making America vulnerable to many things, including all these disease outbreaks. And to your point about data transparency, when you have less people who are monitoring diseases like epidemiologists, scientists, public health analysts, you're not able to gather data, you're not able to publish data, and you're certainly not able to communicate that. And this comes at a very inopportune time when we need data, particularly because RSV, flu, and COVID are going to start to surge in America. So the less data we have, the less safe Americans are going to be.
And Omer, with smaller staffs, I want to talk about critical mission, right? Who's left to stop the next outbreak before it becomes a headline?
It's uncertain, and that's the problem. That's precisely the problem, Diego, that we don't have people to staff this organization if there is another outbreak. And it makes America extremely vulnerable to a lot of these threats. And when you have less and less people that are staffing, remember, this is not just the first set of layovers. There was a massive layoff back on April 1st, and now we have more layoffs, dozens of people, perhaps hundreds of people that will no longer be coming back to the CDC. And with less and less people, I'm afraid that we won't have the staff, the manpower, and certainly the expertise, which is really important to fight a future outbreak or a pandemic if one were to occur.
Omer, I listened to you and I'm wondering if this is a budget move or a power play.
Hard to know, and I certainly hope it's not a power play, and I certainly hope it's not a political move, because infectious diseases don't care about politics, right? Diseases are going to spread whether or not there's a shutdown, and that's precisely what's happening currently. If we take a look at what's happening in Minnesota, measles is spreading. If we take a look at what's happening in South Carolina, hundreds of students are now being asked to quarantine and to come out of school because they have measles. So all these things are spreading despite the fact that there's a government shutdown, despite the fact that there may be politics at play with these moves. So unfortunately, science and public health can't stop even when there is political turmoil.
And Omer, if science is so relegated, do we even have a Center for Disease Control or for disease management?
I believe it's being dismantled day by day. I believe that we're decreasing the experts that we need to be in the field. We are getting rid of people that it is very difficult to replace these experts. These experts are people that have been trained very rigorously to do the things that we just talked about, disease prevention, preventing pandemics. And when you get rid of them, you're doing nothing other than effectively dismantling the whole CDC.
Omer Awan, thank you for your time and insights.
My pleasure. Thanks.